In his address, Dr. Joseph Muvawara, the Executive Director of the National Planning Authority, officially launched the 2025 State of the World Population Report, running under the theme, the Real Fertility Crisis, the Pursuit of Reproductive Agency in Changing the World. He pointed out that the report reveals a continued decline in fertility globally, and in Uganda, the rate has reduced from 5.6 to 4.5 children per woman, as confirmed by the 2024 National Census.
As confirmed by the 2024 National Population Census, we can now see that every woman, we have reached a number of 4.5 children per woman.
He explained that this year's report provides timely insights into shifting dynamics of fertility and reproductive health. He emphasized that beyond statistics, the true fertility crisis is not about fewer births, but about the freedom and agency of individuals to decide whether, when, and with whom to have children.
This year's report provides us with timely insights into the shifts, dynamics of fertility and reproductive health.
Dr. Muvawara welcomed the current decline, describing it as a result of improved access to reproductive health services and education. However, he cautioned that while progress is being made, it's crucial that Uganda doesn't fall below the 2.1 replacement threshold. He noted that high living costs and changing priorities among youth are contributing factors to the decline.
I wish to emphasize that while this trend is positive, we must always safeguard against fertility falling below the replacement level of 2.1 children.
Dr. Muvawara announced that Uganda's national celebration of World Population Day will be held on July 11th in Kayunga district at Busana Town Council grounds.
On the 11th, we will be celebrating the World Population Day, and these celebrations will take place in Kayunga district at Busana Town Council grounds under the theme, Promoting Population Health and Well-being through the PDM.
Dr. Muvawara praised the Parish Development Model Initiative, calling it the most important program of our lives. He said that the PDM is a powerful tool for achieving key national development and population health goals by enhancing economic inclusion and access to services at the grassroots.
PDM enables households to increase their incomes, improve access to education and health care, and live dignified lives.
In her remarks, Professor Pamela Mbabazi, chairperson of the Board of Directors at the National Planning Authority, echoed the significance of this year's theme. She stated that the fertility discussion should go beyond figures and challenge society to ask, are people truly free to make their own choices about having children?
The report highlights that 1 in 10 women worldwide cannot decide whether to use contraception, and 1 in 4 cannot say no to sex. These are clear signs that many people are still denied control.
She emphasized that investing in reproductive agents is more than a good policy, it is a fundamental human right. She urged stakeholders to ensure that individuals have the freedom and support to make informed decisions about their reproductive lives.
Our national plans already emphasize investing in human potential, making sure that young people and women have the support they need to make their own reproductive choices and to thrive. So the key message from this report is simple yet powerful.